Hello, my name is Nympha Gogo, and I'll be taking care of a patient today. Go ahead and perform my hand hygiene. Get my MAR pulled up. My MAR is pulled up and verify my patient, allergies, date of birth, and medication orders. Have Ellen Davis. Ellen Davis, date of birth 99XX, 57 years old. No known drug allergies, no known food allergies, environmental allergies to pollen, and medication. Have sodium chloride, 500 milliliters. To be given at 125 ml per hour. This will be continuous IV, and we will use the drip rate 15 drops per ml. And based on my calculation, I will administer 31 drops per minute. And cefazolin is the second medication, 1 gram and 50 ml sodium chloride to be given over 30 minutes. Using a drip rate of 15 drops per ml as well, and this will be every 8 hours. Based on my calculations, cefazolin I will administer 25 drops per minute. Okay, perform hand hygiene, provide privacy. Privacy is provided for my patient, and I will gather all my supplies. I have all supplies ready to go. Go ahead and verify my medications. Second time, have 500 ml sodium chloride. This is a new bag. Expiration date 10/10/2026. No particles, no leakages. And I have cefazolin, 1 gram and 50 ml sodium chloride. New bag as well. No particles, no leakages. Expiration 10/10/2026. I have my new primary IV tubing and my new secondary IV tubing with my pretend alcohol swabs. They're both new alcohol swabs as well. Okay. Hey, Miss Davis, how are you doing today? Good. Okay. Perform hand hygiene. Go ahead and verify you again. I have Ellen Davis, date of birth 99XX, 57 years old. No known drug allergies, no known food allergies, environmental allergies to pollen. Perfect. Have you verified? I'm going to go ahead and prepare my medication. The medications using aseptic technique. Open up the new sodium chloride, 500 milliliters. Expiration 10/10/2026. No particles, no leakages in it. I have my new IV tubing, new primary IV tubing. I will go ahead and close the clamp. Close the clamp. Just to make sure I don't waste any fluids. And I will use aseptic technique, just a little push up here to get the cap up a little bit. And careful not to touch the tip of the spike. Now was push and squeeze. Okay, go ahead and invert the bag. Get about half in the drip chamber. Okay, and my primary IV bag goes up on the IV pole. Now I will open up the clamp to prime the IV tubing bag. Get the bubbles out and make sure I have fluid all the way to the tip of the hub. Okay. Okay. Get all the air bubbles out. Okay. Looks like we have all the air bubbles out. That is great. Okay, I'm gonna go ahead and set my tubing up there gently. Okay, perform hand hygiene and don new sets of gloves. Access the IV site before I start the fluid administration. Okay, go ahead and inspect it. No redness, no rashes, no swelling, no discoloration. Do you feel any pain around the site? No. Okay, I'm gonna go ahead and get my new alcohol swab. Open it up And I will clean the connector port for about 15 to 20 seconds. Give it a good clean. Okay, good clean there. Grab my primary IV tubing, the connector. Go ahead and connect that. We have that going good. Okay, get my gloves up. Perform hand hygiene. Okay, now I will go ahead and set my drip rate of 31 drops per minute. Start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31. Okay, we have 31 drops per minute. 31 drops per minute. Go ahead and perform hand hygiene and prepare the secondary bag. We have 1 gram cefazolin and 50 ml sodium chloride. Expiration 10/10/2026. No particles, no leakages. So I have my new secondary IV tubing. And I have my 2 strips poles up here. So I'm just going to go ahead and use what I have on the wall rather than using this extension that came with the tubing. Okay, using aseptic technique. Careful not to touch the tip. With a push and a squeeze. Okay, let me go ahead and invert. Make sure my clamp is closed all the way. And give it a squeeze, get about half in the drip chamber. And now my primary IV bag goes lower while my secondary IV bag is slightly higher. Okay, we'll go ahead and prime the IV tubing. I have my receptor here to collect whatever excess, but I try not to waste any medication. Go ahead and prime my IV tubing, get the bubbles out. Okay. All right, we are good. Get all the bubbles out. Great. Go ahead and set this up here. Okay, perform hand hygiene. Now I'm gonna don my new gloves again to reassess the IV site before I start administering the secondary medication. Okay, take a look. Is there any swelling? No swelling, no bruises, no rashes, no discoloration. Do you feel any pain? No? Okay, you don't feel any pain? Okay, that is good. Okay, go ahead and get my gloves out. Perform hand hygiene. And I will go ahead and close the clamp on the primary tubing and locate the Y port on the primary tubing. I have my new alcohol swab here. Go ahead and open it up and clean the Y port for about 15 to 20, 30 seconds. Give it about a good clean. Okay. And now I will get my secondary tubing and connect it the white port. Okay, that is done. I will go ahead and open the primary, open up the secondary IV clamp, open up the secondary clamp, and I will use the primary clamp to set my drip rate for my piggyback fluid. That's the cefazolin, and I will administer at 25 drops per minute. Start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, and we have 25. 25. Okay, have 25 drops per minute for cefazolin, 1 gram and 50 ml sodium chloride. Go ahead and perform hand hygiene. Don my gloves. And reassess the IV sites one more time. Gonna go ahead and inspect it. No redness, no swelling, no discoloration, no rashes. You feel any pain? No pain. Okay, that is good. No pain. I will go ahead and dirty gloves off. Perform hand hygiene. Okay, Miss Davis, you tolerated the procedure well. Here I have put you in a comfortable position. I have your call line here. If you have any questions, any concerns, just hit the button. I will be here to answer any questions for you, okay? And also, I'll be back in about 30 minutes to reassess and check out IV fluid. It should be done by that. And I will go ahead and document the fluid administration. I'll see you in about 30 minutes. Bye.